As we continue to fight the coronavirus pandemic, it's important we don't forget about our furry friends. The CDC is aware of a small number of pets infected with the virus, and right now doctors are seeing an uptick in pet emergencies. So joining me now to talk about how you can keep your dogs and cats safe during these uncertain times, Dr. Christian Broadhurst, a vet at Clay Humane. Good morning. Thank you for joining us.
Thanks for having me.
So why do you believe we're seeing an uptick in emergency cases?
Well, there's a couple of different factors involved. One, people are certainly spending a lot of time at home with their pets and going, that probably shouldn't wait. I should go get that taken care of, where normally you're at work and you may not have that opportunity. Also, we certainly have, despite our best efforts, not been able to keep up with the amount of animals that need to come in. So I think a lot of the time they're spilling into our afternoon and evening urgent care.
What kind of injuries are you guys seeing as that emergency?
We're seeing the garden variety of injuries, vomiting, diarrhea, all the GI upset stuff. But we're also seeing some things that have certainly spilled from our normal appointments. Things like skin disease, so things like ear infections, things that would normally be seen during the day that we simply can't get to given the volume of our staff and the volume of patients that need to get in.
Have you guys seen any cases where an animal was infected with the coronavirus?
Thank goodness we have not. We have been not really affected in our area as far as animals being concerned about coronavirus, and we have not had to test any.
What about flea and tick season? Isn't that coming up soon?
Oh, we're in the middle of it. Absolutely. We're in the middle of kitten season and bug season. So fleas and ticks abound. And certainly a lot of what we're seeing is skin problems related to skin infection and fleas being a large driving factor.
It's definitely not the time to forget to get those prescriptions. No. What do you recommend for people that really, I still maybe don't feel comfortable going out and getting that?
Well, we are doing curbside service for the vast majority of our patients. So if you are concerned about your animal, but you obviously don't want to risk exposure to yourself, we have people coming up. We are taking the animals into the building, doing their exams, doing their diagnostics, getting them medications, chatting with the owner very briefly if they need it, and then getting our animals out of there with the owners not sitting. So that is helping a lot of people who are truly worried about, obviously, with comorbidities and health problems, not wanting to come into contact with any more people than absolutely necessary.
Yeah, just know everybody's willing to work with each other, especially to keep our animals safe. Dr. Christian Broadhurst, thank you so much for joining us.
Thanks for having me. I appreciate it.